On Monday, okay, okay, okay. Not stressed. No, don't be stressed. You're gonna be fine.
It
You'll
just
be
keeps
fine.
adding them. You're like, it's not gonna.
Yeah, and I don't know which words are harder. Those words are the words that I try to say. Mine? I don't. Yeah, yeah. So today we're going to finish up the lecture portion of research evaluation. I apologize for last week. I was feeling sick and I had to go to sick call, but I'm better now, fortunately, so I'm back at work. And unfortunately, you guys have to see my big head in front of you. So 2 lectures. This lecture that we're getting into, lectures 4 and 5, we're gonna it's a lot of just general information and definitions about study designs and research articles. Some of this information is you guys are probably very familiar with. Then the next lecture, we will finish in the next hour, and I will go over 2 examples of assessments. You guys will be completing 2 assessments for this class. I will go over the assessment criteria, and if you guys have any questions about the assignments, because I'm gonna go over a detailed instruction list, please let me know. So, all right, so I'm gonna start with information about basically a research article. But before I do, I wanna stress this because I'm not sure if this is clear. You guys will not be tested on anything that we've discussed in this class. All of this information and all of the slide decks is supposed to help you complete the assessments for this course and your capstone research project. Hopefully some information in this course. That's the design, is to help you create your capstone research project. And because there may be a lot of new terms, hopefully some of these slide decks and some of the information on the slides will help you understand some of the terms. So you won't be doing any statistics for anything. You will be hopefully using this information to help you understand why certain statistics are being done in the research articles that you guys are going to use for your capstone project. Does that make sense? Is that clear? Okay, good. All right. So we're going to start off with just some general definitions of what a research article is. We can think of a research article as kind of like a patient handoff, sort of. And so research article is a summary of what a group of researchers did on a particular condition. So there are many different sections to a research article, starting out with the title. The title sometimes could just clearly state a PICO question. It could state the findings of a particular PICO question. It could also be creative, and sometimes authors will use creative writing to develop their title. And as you guys will learn when you are assessing articles in this class and when you're looking at articles for your capstone project, sometimes the title doesn't really fit with what they're doing, and we're going to talk about that in the next lecture today. So the abstract is a snapshot of what the researchers did, what they found, and the main results. It's like an elevator pitch of what they did and why. Then you have the introduction. So the introduction is where researchers are pulling from previously published data, and they're kind of setting the stage as to why they're doing a particular study. So typically, studies will piggyback off of previously published research, and they use articles that have been published, and they take a slant on their research project, or they use similar methodology or similar drugs in a different disease state as rationale and justification for asking a particular question. The methods are stating what the research did, the study design they use, participants, any criteria they use to select their participants, and then the analysis that was used in a particular study. So that's the statistical analyses or some other analytical tools that can be used in research articles. The results are a description of what you found in your study, what the researchers found. That's it. No subjectivity. The subjectivity comes in the discussion where you're trying to now interpret what you found and relate it to what's been previously published, either comparing or contrasting it, and then you're coming up in the conclusion, which is what you think your findings mean in relationship to whatever you're studying and the field of medicine in general. And so then you have references, of course, all the articles you used as citations for your study, and then acknowledgments and disclosures if there are any, and then supplemental materials. So supplemental materials are materials, data that you found that may not exactly answer the question that you ask, but may provide important background information as to why you did the study in general. So that information is not going to be a part of the actual research article itself. It's found in usually downloadable supplementary data. Any questions about the sections of a research article? All right. So we talked about this in the first lecture, the 3 pillars of medical research. You have the research, the preclinical research arm, clinical and epidemiological arm. So depending on what type of PICO question you guys ask for your project, you're probably going to be in these 2 arms, either clinical or epi lanes. And within those lanes, we have the observational lane, which is where the authors who conduct a study are looking at what happens without any manipulation of parameters of the study. So no intervention. Then the experimental arm is where you intervene by adding a drug, for example, when you're looking at drug treatment. So there's 2 main types of research, primary and secondary. Primary research, you've developed the hypothesis. You're going to test that hypothesis using statistics. You come up with the study design and protocol. Primary research takes longer, it's more expensive because you're actually doing the work. Secondary research, which is what you guys will kind of be doing for your PICO projects, and then in practice you'll be doing it as well, is you're taking data that has already been published, sometimes not published, sometimes data found in databases, and you're doing some type of secondary analyses of that data to answer related or sometimes even different questions. And this secondary research is much faster because the data has already been analyzed, and so reanalysis is not going to take as long. And this is much cheaper as well as a means for research. And so some of the different study designs use both primary and secondary research, and we're going to talk about some examples of those. So you guys are familiar with the Joe survey, right? When you go to the clinic, have you guys filled out the Joe survey? No? They don't send you guys the Joe survey? Have you heard of them? Oh, they send them, you guys don't fill them out. Oh, okay. Okay, got it. So they're the surveys when you go to a provider, and they have both qualitative and quantitative questions on the survey. And so the quantitative questions are the questions that have a numerical scale asking you particular things about the services that were rendered. Those are analyzed using descriptive statistics. And then a qualitative study is the free text portion of those Joe survey, where you're allowed to input whatever you felt, if the service was good, why, if the service wasn't so good, why, any recommendations you have for the services. And so that is qualitative because it's not using any numerical calculation or analysis. It's looking at particular themes. So when these surveys are compiled, if patients have the same ideas about what they think the services should provide or don't provide, those themes are going to be combined as a recommendation, and it's going to be written in some type of way to hopefully better help with patient care. That's kind of the purpose of the JOL survey. So this is one example of a survey that uses both qualitative research and quantitative research. And again, qualitative research, they don't use numbers. They're asking questions like, how is something working, or why? And then we know quantitative research is delving a little bit more using descriptive statistics or a number of other advanced statistical applications that's asking primarily about a relationship between one parameter and another. And there are two different examples of qualitative and quantitative questions that can be asked or studies that have been done. What are your questions about qualitative versus quantitative research? Has anybody done qualitative research before, like in college course? If you don't mind speaking about what you did.
So I worked on a capstone for MHA.
Oh, cool, okay.
I needed to go ahead and conduct the readmissions for hospital rates and how that corresponds with existing conditions that the patients have.
Okay, and so how did you, what modalities did you use to do that qualitative research, excuse me?
So a lot of surveys.
A lot of surveys, okay. Was there any type of component that was qualitative as well, or was it just mainly only quantitative, or was it just only qualitative?
So it was a mixture. So I provided my capstone to show qualitative and quantitative.
Yeah. Okay, good. Thank you for that. Yeah, so sometimes those two types of research are mixed together. They normally say that the softer sciences like psychology and sociology, qualitative research, and then the hard sciences like medicine and biochemistry, microbiology, those type of sciences focus more on quantitative research because we're looking at relationship in those type of research arenas. Any questions about the differences between the two? Oh, all right. So here are some of the main research study designs. Now we're getting into the meat and potatoes of what we're going to talk about today. So the top several, all the way down to non-randomized controlled trials, except for observational studies, these are interventional studies. And so they all use randomized controlled trials, which are the gold standard for interventional studies. RCTs, I believe I might have mentioned this before in the first lecture in this course. That study design helps us determine causality or cause and effect. So did drug X help treat condition Z? So that's what we're looking at for interventional studies, and RCTs are the primary means in which we determine that type of causality. For the observational studies, again, those do not use any interventions, and there are a number of different types. You have the cross-sectional, that's looking at one snapshot in time. So you're looking at a particular population that was exposed to something, who got the disease and who didn't get the disease, and you're comparing the two groups for cross-sectional studies. For case control studies, in the case control study, that is, you're looking retrospectively, so back in time, you select a population that has a rare disease, and then you look back in time in that patient's records to medical records to identify how often the patient was exposed to whatever caused said disease. Also, you are interviewing the patient, and the patient is completing surveys where they have to try to recall times that they've been exposed to whatever the agent it is that's causing the disease. Cohort studies is just following a group over time. That can be retrospective or prospective. Then you have nested case control study. So that is basically, the latter two are cheaper ways of conducting large scale studies. And so nested case control, you are selecting, so if you're looking at exposure to a certain disease, every time someone within the full cohort gets the disease, you are selecting a control from that cohort and comparing the two. When you do this, you might be looking at biomarkers, so you might collect the blood from the patient to see if certain things change in the blood, or you might also be conducting interviews and surveys to identify when the patient was exposed to whatever is causing the disease. And then case cohort study is you have a large cohort, maybe 10,000 patients, and at the beginning of your study, you select a mini cohort of a couple of hundred patients. So you're going to use that mini cohort every time somebody gets a disease in that group as well, and you're going to compare it to the mini cohort. Are there any questions about the observational study designs? And this is just a schematic of the information found on the previous slide. So you have the quantitative research as the umbrella, and then the experimental arm with the RCTs and non-RCTs, non-randomized controlled trials, and then the observational arm with all of the different types of studies that I just mentioned previously. So, relative to time, the observational studies, a prospective study, you're starting at exposure, you're looking over a period of time to see who develops a disease at the end of the study versus who doesn't. Retrospective, you're going the opposite direction, so you already know who has the disease and who doesn't, and you're trying to identify the exposure paradigms for that group. These are both longitudinal studies. Some studies are 10 years or longer for some of these cohort studies. And then cross-sectional, one snapshot in time, you're looking at a group that has been exposed to something, who gets the disease, who doesn't at one point in time. Any questions about the time constraints of observational studies? Yes. Say.
Are any more valuable than the others?
Yes, great question. I'm glad you asked that. So, yes, they are, because they all have advantages and disadvantages. I mentioned the latter two, especially for the observational studies, case control, they're cheaper because you're not testing the entire cohort. You're only testing people that got the disease and comparing them to those who did not. And here's a summary of the different aspects of the observational studies I just mentioned in terms of the population, the study. We talked about the directionality, the uses and what they're measuring, including the statistical applications. We talked about all of these in the stats lecture. The advantages and disadvantages of each. And so there are unique advantages and disadvantages of each. Retrospective and case control are cheaper than doing a full cohort study and prospective study, because retrospective study, you already know who has the disease. So you have a group of people who have the disease, you're comparing those who don't. For the prospective study, no one has the disease, so you have to wait, may take years, and you're testing all these people to see who develops a particular condition. And so all of these study designs have low internal validity and high external validity. And the reason why is because I mentioned earlier, for observational studies, there's no intervention. And so because there's no intervention, that kind of simulates what happens in the general population. And so that gives these study types high external validity. For internal validity, that is when study participants, they are intervening and they're controlling parameters of their study design. That is not done in observational studies, so these studies have low internal validity. So some ways to improve your internal and external validities, and of course this wouldn't be for observational studies, this would be for the experimental study designs. You improve your internal validity by controlling the parameters within your study design by randomizing your control and treated groups, and also going a little bit further if you blind your group. So you've probably seen, you might have seen double-blinded randomized control trials. In that study design, the groups, both the treatment group and the drug-treated group, is unknown to the participants and to the researchers. So basically no one in the study knows who's getting the drug. So the data will be less biased and will be more, that will improve the internal validity. To improve the external validity, increase your sample size, diversify your sample size with different ethnicities, different ages, and including both male and female gender. That's ways to improve the external validity of a scientific study. And good articles, as you guys will see as you're doing your capstone project, they will mention, they may comment on the external validity, internal validity, and some of the inherent biases that the studies might have. So a bias is something that is going to distort the actual findings of your study, and it can occur at any time from participant selection all the way through data analysis, depending on what type of bias it may be. You have selection bias, and that is what I mentioned, not when your groups are not randomized, and then different types of information bias. So one example of information bias is recall bias. So for a retrospective study, you're looking at people who have a disease and they're going back in time to see their potential exposures to whatever agent is causing the disease. So you're looking in their medical records and you're also interviewing the patient. Well, they may not remember all the times that they were exposed. They may not associate an exposure to them getting sick and eventually getting the disease. Also, they may not have gone to the doctor every time they were exposed, so it might not even be annotated in their medical record. So that's one example of a bias. That's a recall bias. Another example, yes?
On that note, like if you're doing a study like you're talking about,
Mhm.
and you're looking for specific things, isn't that a bias in and of itself?
Absolutely.
Like where
Absolutely. Yep.
it could not be associated with that disease at all because you're looking for it in correlation with that disease process.
Yes.
Okay, yeah.
Yep, and you could mention that in your paper, like we understand that there are biases are found due to us identifying or selecting participants that have X, Y, Z. Like most articles that put that up front, they're being honest, so they're not trying to hide it. That's a very good question. And yes, and like I mentioned the example with the case control, you're selecting people who have a disease. So you're looking for somebody who has a rare disease because you're trying to figure out why. So that is an example of a selection bias as well. Yeah. Was there another question? I thought I saw another hand raised. No? Okay. Does that make sense? Yes? No? Sort of? Okay. Also, confounding variables. We talked about this when we talked about how smoking can cause lung cancer. I mentioned that some smokers drink, and drinking, as we know from biochemistry, causes free radicals in the body, and so that's going to potentially affect not just the liver, but it can also affect the lungs too. So that is a confounding variable in a study. And so again, authors, sometimes they're able to identify some variables that they might be confounding variables, and they will mention that in the study. The more they mention the things that might kind of dilute their study, the better article it is. If they try to hide it or they don't mention anything, then the paper is generally considered lesser quality. Not in all cases, but if they mention it up front, it's like, okay, yeah, they're trying to be honest and they're trying to like explore all the possibilities as to why they found what they're finding. They're just not saying, oh, this causes this, the end. So, and so for removing confounding variables, you can just, annotate it in your article, or for this example that I just mentioned, if you are looking at smoking as a risk for lung cancer, you would have participants that you would not include participants that smoke and drink, only those that smoke. So, in terms of lowest to highest synthesis of research, this is a ladder, but it's going down instead of up. So we start with descriptive studies, case report and case series studies. These studies are used to identify unique situations in unique conditions. So in these studies, you're not going to have a large population in your study population or in the data set that you're looking at. And so there's not going to be a lot of statistics because there's not a lot of people that have this condition and are facing the situation that you're studying. So this is a lower form of research. As you move up the ladder, or down in this case, you're adding analytical studies, for example, the cross-sectional and case control study that I mentioned, where you're trying to identify causality a little bit, cause and effect, the temporal exposure of X toxic agent causes Y disease, for example. And as you continue to move up, you're looking at this type of information in larger sample sizes for longer periods of time, and that would be in a prospective or retrospective cohort studies. For the definitive causality study design, that would be randomized controlled trials where you're looking at cause and effect. This drug helped treat this condition, and this is why we believe it's doing this, because it lowered X biomarker in human blood. And so for the RCTs, once you filter that research, you combine the randomized controlled trials in systematic reviews or meta-analysis studies. That is combining all of the data to see if there is to see what the effect size is of looking at thousands of different randomized controlled trials that sometimes are being conducted all across the world. And I'm going to talk about an example of that in the next lecture. And so because of the control that you have for that type of study, you're using highly advanced statistical applications to determine the effect sizes from groups that use different methodologies and that were in different parts of the world. This type of research, it has both high internal and external validity. And so this is the type of research that feeds into what becomes patient care protocol or clinical practice guidelines. Any questions about the synthesis of research data? All right. And so here is information about study designs, each study design and their generalizability to the population as a whole. Here are the different study designs and the sample size or the N values that they use per study. So we know with the smaller N's, they're not going to be generalizable to the population. They just don't have enough in the power analysis hasn't been conducted on these studies, so that you won't be able to take this information and say in a population, in a broader scale of population, that the data found in this study will be useful. Now, that doesn't mean these study designs don't have utility. It just means that you have to understand what utility they might have. And again, we're going to see an example of this later on. As you move up to cohort studies all the way through large database and registries, you can have several hundreds to millions of people. Of course, that's going to include very diverse populations of diverse ethnicities, ages, and sometimes genders. And so those are more generalizable to the population as a whole. And here's just general information about the different study design types, what they're used for, the type of particular study design temporally, and then some examples of each, just so you guys can use this information when you're looking at your articles for your PICO project, and again for the analyses that you will be doing in this course. So you guys have probably already done this. During the orientation week, were you shown how to conduct a literature review? Yeah, so I'm just gonna go over this really quickly, but first you have to come up with your PICO question, of course. And with the PICO question, if we take this one, in adults with hypertension, does a low sodium diet compared to standard diet reduce blood pressure? If that were your PICO question, you would develop or identify keywords and synonyms to those. For these examples shown below are ways that you can set up your search criteria in the different medical databases used. I'm old, so I use PubMed. I don't know if you guys use this one. Okay, good. I see some heads nodding. Yeah, so I know there's a lot newer ones now, but this is what I learned how to conduct literature reviews when I was in grad school. And so with PubMed, there are advanced settings that allow you to select by study design, select by date ranges, and also use the Boolean operators and or. And so if you guys aren't familiar how to do this, the librarians here and at UMNC will help you, but it's kind of pretty easy to do. And if you haven't started doing this already, you can use this information to you'll get a lot of articles, and then you'll have to start filtering through the different articles to find ones that are pertinent to your particular topic. And we're going to talk about how you can do that in the next lecture. And so I mentioned the Boolean operators and, or, are not. Use those when needed. You can combine terms and string terms together to help you tease out and to pare down the list of exactly what you're trying to find, and that will help you find a list of articles that will be more manageable in terms of numbers, because sometimes you can do a search, and if you're not specific enough, you can come up with thousands of articles, but of course you don't have time to look through those. You just need a couple of recent articles to start with, and then if you don't like certain articles, then you can continue your search, and this is how you would go about doing it. Are there any questions about this? No? All right. And remember, we talked about this in the first lecture. So depending on the question type you ask for your PICO question, these study designs are preferred. So if you're asking a therapy question, of course, I mentioned RCTs are the best study designs, as are any study design that uses RCTs, like systematic reviews and meta-analyses. And if you ask a different type of question, these are the study designs. So you can select study designs specific for the type of question you ask when you do your literature search, so you get the best type of articles to answer whatever question you're asking. All right? Any questions? All right. Now we're moving to the historical relevance, or the historical aspects of why institutional review boards are required. So, but I'm going to start with IACUC. This is animal research. So some of you might have already conducted animal research. This is what I did. And IACUC, Institutional Animal Care and Use Committee, is basically designed to protect the welfare of animals. This is mandated by the USDA and the Public Health Services. And so here's the composition of IACUC. So this committee will examine your animal protocol that you develop to determine a number of variables, and they'll also inspect your animal facilities to make sure that you are conducting research in a humane way. For your protocol that you develop, they're looking at the number of animals that you use. Is it too many? Is it too few? Are there alternative models that you can use for your studies instead of using animals? And how are you discarding or euthanizing your animals? Is it in a safe and humane way? That's the most important component of the IACUC committee for animal research. So for human research, there is a selection process. Some of this, well, actually most of these pillars, the 5 pillars of the selection process for human studies, is based on the Institutional Review Board. Institutional Review Board is what protects human subjects. And the criteria here, 5 pillars: voluntary participation, screening of the patient, and, including the different demographic representation of your population that you're studying, and then of course the ethical oversight. The Institutional Review Board protects humans, in particular vulnerable populations. And we're going to talk about some historical cases as to why this is important, or this became important. So where is the IRBs for the military? Well, they're usually located at our medical centers. If there's no medical centers, there may be Department of Research programs where the IRB is located. At MedCenter, it's located within the Department of Clinical Investigations. And the IRB gets its authority from the FDA, because the FDA is what protects human studies, and the IACUC USDA is what protects animal studies, protects the animals in animal studies. So why do we need an IRB? Well, throughout history, there have been a number of different examples of cases where inhumane studies have been conducted in humans. We're going to talk about some examples. There are some hidden you might want to look at. They're really short. We're not going to go over all the different examples, but the impetus of this was what happened in WW2 at the Nuremberg trials. They found that research was being conducted harming patients, no concerned care about patients at all. And so the Nuremberg Code is what set the premise for how research should be conducted in humans. And there was 10 principles of the Nuremberg Code, main one being informed consent or voluntary consent, because we know during World War II that was not voluntary. And there are a number of other pillars. So what came after the Nuremberg Code was the Declaration of Helsinki in 1964. This extended the Nuremberg Code, and this was particularly when looking at research conducted in humans, that you needed a medical provider to be a part of that study and what they would do to help support that study. And basically they found with the Declaration of Helsinki that if there's a treatment for whatever condition you're studying, then you need to give that to the patient, and the patient's interest in the study is more important than the societal gain of whatever you're studying. And so even after these two regulations or acts was passed in terms of human research, there were still a number of cases of unethical research occurring in the United States up until about 50 years ago in the 1970s, even here in San Antonio. And here are some of the different examples of cases that basically caused the US Senate to require congressional hearings to figure out, why is this still happening? What's going on? How are we going to change this? And this was the starting talks to set up what we now know as the Institutional Review Board. So we're going to talk about a few of these cases. First one, I mentioned what happened during WW2. The Nazis conducted a number of unethical studies in concentration camps. They used extreme temperatures. They performed surgeries without anesthesia. And the purpose of these studies was to figure out ways to make the German soldiers more resilient. And here are some of the ethical violations that these experiments violated or hindered. So there was no consent, of course, and they didn't care about pain or harm that they inflicted. At Yale University in 1961, the Milgram study tested obedience. And so what they did was they had participants shock actors that didn't follow directions. And so the actors were faking pain of being shocked. They weren't really being shocked. So of course that added undue emotional stress to the study participants. And so the violation for this is basically they were just the study designers were being deceptive, and they were causing undue harm by not revealing the actual purpose of the study and what was being done. So they wanted to see how far the participants would go to comply with whatever orders they were given. That's messed up. I'm sorry. I think that's really messed up because you are causing people like, I mean, of course the study participants, they weren't like physically harmed, but sometimes emotional harm can be worse. So even here in San Antonio, there was a study done that were giving placebo contraceptives to Mexican Americans that could not speak English well, and so they wanted to test the effectiveness of oral contraceptives and the side effects. Again, deception, and you're targeting a population that doesn't speak English. I mean, again, just not right. And same thing with the Tuskegee syphilis study that happened for a 40-year period where syphilis was given to 600 African American men in Alabama to test the disease progression. Even after it was found that penicillin would have treated them, they weren't given the penicillin. So all of these different ethical violations were occurred in this study type. So if we look at these different study types, some that I didn't talk about, everything in red were all of the principles violated, and in green, the principles were not violated. So you see that they just didn't care. I mean, and so it's unfortunate, but that's why those congressional hearings were held by Senator Kennedy, and that established the 1974 National Research Act. And this required federally funded research in order to conduct medical research in humans. And that is what set the law that the federal laws that established what we now know as the Institutional Review Board. And this NRA of 1974 issued the Belmont Report. And so the Belmont Report are the guiding overarching principles for conducting research in humans. They should be informed. They can withdraw anytime they want. Their information is confidential. That's respect for persons. Beneficence, that means that those participants in the study should gain as much benefit as the population at large. And then justice, the people who face the risk in the study should also benefit from the results as well. Are there any questions about the IRB? All right, take a 10-minute break and we'll finish up with the assessments. Wow, okay, dang. That was supposed to be that was a joke. Thank you, dang. Oh, hurt me because you don't bite any of my horrible attempts to make you laugh, but that's okay. So here are the instruction assignments in detail. Please follow these. So in Canvas, you will need to upload your assignment into Canvas. So there's a text box. I want you to cut and paste your assignment from the Word document into the text box and upload it. Do not attach it, but upload it. Again, do not send me the assessment via email after you've uploaded it. That's gonna clog up my email. And if I have any questions or I didn't get yours, or the format is messed up, I will contact you directly to then send me an email, but don't send me an email once you've uploaded it in Canvas. For the article assessments, do not attach the article that you're assessing. Do not write a summary of the article. I'm going to do that for the 2 articles I'm assessing only because you guys didn't read them. So don't write a summary of the article and include that as a part of your assessment. Only choose articles found on the research evaluation Canvas cover page. And all of these instructions were written because people did the opposite. So, I mean, I'm easygoing, but like if you don't follow this, I'm gonna be forced to take off points, and I don't want to take off points. It makes it harder. I have to do more typing and add more comments. And I don't want to do that. I want to be impressed. I want to laugh at your evaluations, because sometimes the evaluations, y'all say some stuff that's funny. Like my first time teaching, one guy, I mean, they're just brutal. He said, this article was written like my dad. He's a foreigner from Russia that could barely speak English. That's what he put. I was like, dang. You don't have to be that brutal, but if you are, I will be laughing in my office, so I'm not gonna complain about laughing. Another person, he did an assessment. There was an article about semi-domesticated deer that caused injury. And when the question was on the criteria, is this generalizable, does this represent the full population? And he said, no, because most people don't have semi-domesticated deers. I was screaming in my office. I was laughing so hard, my next door neighbor came, was like, are you okay? I'm like, I'm reading some very, very good evaluations. So you guys make me laugh, it'll help my eyes. Because reading all of these, I have to read these twice. So don't write books for the assessment. I say this, but you guys are gonna be writing books. That's okay, I'll still read them. And they are due on March 17th and March 30th at 23:59. Please make sure you upload them on time. And here's where the articles will be found on the Canvas cover page with the rubrics. There's a template that you can use to do the assessments, and here's where you will upload them on Canvas. So you can just search journal and it'll give you the different ones, the different assignments, and you'll just upload them to Canvas. Remember, follow these instructions. And if you have any questions, again, please let me know. I mean, seems like a lot, but it's not really that difficult. Y'all are brilliant. Y'all are here. Y'all are brilliant, doing well. Y'all can follow these instructions with no problems. So any questions so far? All right. So I'm going to briefly talk about this step-by-step approach to presenting at Journal Club. This is a good article because this, in my opinion, will help you with your capstone project using some of these 10 different steps. Also, some of the information in these steps were used to develop the assessment criteria for this assignment. So I've highlighted some information in each of the steps. Some of them may or may not be useful in terms of what is found on the assessment rubric, but when you are presenting an article, and you guys, by the way, will probably do this, I believe, in phase 2, and in practice, again, all this stuff you're doing now is setting you up for practice. You're going to be doing journal clubs in practice as the clinical guidance changes, as you have patients with unique cases. You're gonna have to look in the literature to figure out how to best treat your patient. You're gonna be using some of these steps to do a clinical journal for the group that you're working with. And so in the first step, of course, you start with that PICO question. What are you looking at? Why? What you found in the literature? Who wrote the paper? This may or may not be important in terms of the assessment criteria, but sometimes it's important. Particularly certain journals have what's called impact factor, and the impact factor is kind of like a grade for a particular journal. And impact factor is based on a number of things, but it's based on how frequently a particular article is cited in a given year or whatever period of time the journal set. So basically that means the impact factor, if an article is cited a lot within a year, that means the research is deemed to be very useful, very important. And so a lot of research groups are using that information and they're including it in their studies as well. So one thing I recommend you doing when you read these articles for this assessment, don't read the abstract, just black out the abstract. Because the abstract, as I mentioned earlier, it's a snapshot, it's the elevator pitch. It's trying to get you roped into what they think they found. And so I want you to read the article without any biases from reading the abstract. And so the hypothesis, step 3. So do they have all the PICO elements? If they don't, why don't they? Some study designs don't always have all of the PICO elements. That's inherent to the particular study design. But if they're missing, why was it missing? What does that say? How does that change the findings of the article, if it does or if it doesn't? What did they use to measure the outcome, like the intervention used? Those are, all the different PICO elements that you have to include in a good scientific question for conducting research. When you get to step 4, this is if you're conducting a journal club where you will assess the article for the student rubric that you guys will be using. You're going to basically comment on whether what you think about the hypothesis, was it correct, what's known on the subject already. And so typically, and I believe I mentioned this when I was talking about the sections of a paper. So research is kind of piggybacking off of previous studies. And so this last line is basically how it's very common in some form in research articles. So the authors will say, intervention X has been shown to show significant reduction in patient group Y. However, no studies have assessed the effect of intervention X in patient group Z. And so again, this is where you're using a drug for a different condition, or you're using a method that's commonly used in one type of research and another type of research. You're kind of setting the stage for why this study is so important. Step 5, here's where you get what study design did they use? Did they randomize a study? Did they mention any biases? Was the study design appropriate for the type of question they ask? And what was the validity? What do you think the validity of their study is and why? For their methods, and 6 and 7, did they talk about power analysis, meaning like they calculated how many study participants they needed to be 80% sure that they would be able to reject that null hypothesis and find a true group between the true difference between the groups? And did they use p-values at all? Did they use confidence intervals in their studies? That's what you guys are going to be mentioning or commenting on in the assessment. And then what does the information tell you? Is it clinically significant? If not, why? If so, why? How might this information affect your clinical practice? Or would it affect? If it won't, you can say why. And then this is something, if you're presenting a journal club and you're very interested in the topic and you want to continue conducting research in your field, this is when you're in practice. You could reach out to the authors or the journal to discuss some of their studies to find out more information about it that's not published. So, but in terms of the rubric, here are the questions that you guys will be answering in the assessment. And there are numerical values associated for each criterion. And you will grade the article based on, does it exceed expectations? Does it meet expectation? And is it below expectation? And of course, how well you assess the article is how you will be graded. Any questions about that? Yes.
Will assignment 1 and 2 have 5 different articles, or is it just, hey, I'm gonna assess one for assignment 1, and then assess the second one from the 5 that you?
Yes, it's only 5 for total.
Meaning
So
that we could potentially hit both assessments this weekend.
sure, if you want to, yeah, yep. Any other questions? Oh, sorry. He asked, are there only 5 articles total for the 2 assessments, or are there 10? So there's only 5 articles that you will have to choose 2 different study design types. There may be more. There may be one or more article with the same study design. I want you to assess 2 different study designs. So you have to look at the articles, not read them all, but look at them. So. All right, so the first article that I assessed was a case report on hemolysis in G6PD deficient child due to acetaminophen overdose as a result of parent unawareness. That is the title. Again, remember, don't read the abstract. This is a screenshot of the cover page of the article. Now, I provided summaries because you guys did not read the article. I have my summary and then the take-home summary from the article itself. So basically what happened in this article, there was a child that was sick and his parents took him to the emergency room on 3 different occasions in a short period of time and were prescribed 3 different drugs that had acetaminophen in it. And we know this is bad for G6PD patients. Why? Say again? Right, they can't make that NADPH when they have G6PD deficiency. So glutathione levels will be reduced, right? Yeah, good. Hey, thank you. Appreciate it. So basically what they found in this article, the scientific findings was that the mother didn't know by the names of the medicine that they all included acetaminophen. And so the patient, because of this, had hemolysis and had to be treated for hemolytic anemia. So that's just a summary of the article. So in terms of the assessment criteria, any questions? The first element we're assessing are the PICO elements. Can you clearly identify the PICO elements? So the answer is no. So in this title or in the article, we have the population G6PD deficient child. The intervention is acetaminophen, and the outcome is hemolytic anemia, but there is no comparison in this group, so I gave it a 7 out of 10 points. The study design is case report, and sometimes the title will tell you what the study design is, so that's easy, right? Not always, but sometimes the title or somewhere on the cover, it will tell you what type of study design used. And a case report are descriptive type studies that I mentioned earlier. They're used for like kind of one-off conditions. Most people in the population don't suffer. And so the study design does match the intent of what they were looking at. Sample size, was it adequate? Does it represent a typical clinical population? Well, it was adequate for a case report because case report has typically one, an N of 1 because it is a unique condition. But of course, we can't generalize this to the population as a whole. This study did reference 5 other similar type studies. So I gave it a 2 out of 10 points, just because they mentioned other articles. But again, I want to, like, your scoring is less important. I want to see what you write for your explanations. So, you could give it 0 if you don't think it meets if it's not generalizable to a clinical population, but I want to know why you feel the way you feel. That's the most important. Does that make sense? All right. Validity and biases. Did the authors mention ways to reduce this? And as I mentioned earlier, typically good papers, the authors will discuss this in some way. They will try to at least identify some in their paper. And this group did kind of try to tease out potential confounding variables of the disease. They talked about WHO scale. This scale is an algorithm used by clinicians to determine the likelihood of a drug causing an adverse reaction. It's not a statistical analytical scale, but it is a scale used. And so the authors did mention a comment that they feel like based on the condition that this patient had and the effects that they saw, was likely due to acetaminophen and not any other variable of the particular situation that this patient was dealing with, or any other type of dietary or anything else that the person might have encountered within the previous days when they became ill. So I gave them 1 point for that. Now the statistics used, there weren't any in this study, which again is typical for descriptive statistics. They might use statistics for some of the some information in their paper, like some of the studies, another case report that I looked at used statistics. They were looking at blood work for a patient, so they used like blood work statistics, but that wasn't really addressing the actual condition itself. And so I gave them 1 point because they used that WHO scale and the Naranjo scale. This scale is also a scale that determines the likelihood of an adverse reaction. So they use 2 different scales to try to determine cause and effect of this condition, the hemolytic anemia in their patient. And based on these 2 scales, they found it likely to be caused by the acetaminophen. So I gave them 1 point. Clinical significance. Can this result be applied to patient care? What did I learn? Would this change anything in your clinical practice? I also added for you guys can also comment on, would you do anything different in the study to make it more relevant? And so what I said for this article was that basically this study highlights the need for patient education because the mother did not know that all of those drugs contain acetaminophen. And so she gave her child, acetaminophen containing drugs, which is already dangerous for his condition, but he kind of had a probably toxic amount, which is gonna make his condition worse, not to mention he's already ill. And so I put that this does have important clinical significance because it's sometimes difficult to treat complex, unique conditions. So even though it can't be generalized to a population as a whole, it does provide utility to the area of medicine because this can happen to people even though it rarely happens because you're dealing with a rare condition. Then you comment, the last comment would be about what you think about the writing and structure of the article. Was it easy to read? Were the conclusions clearly defined? And I said, yeah, it was pretty easy to read and everything was stated in a succinct manner. So I gave them 4 out of 5 points with a total of 31 out of 50 points for this article. Any questions? All right. The next article is a comparative efficacy and acceptability of 21 antidepressant drugs for acute treatment of adults with major depressive disorder, a systematic review and network meta-analysis. So again, already you're seeing the study design used is telling you, which is good. And again, don't write a summary. I provided this because you guys didn't read it. This is my summary. 21 antidepressant drugs were tested in patients with MDD, and they used a number of advanced statistical analyses to determine the effect size of the drug. And they found that all of these drugs produced an effect that was significant, essentially. And so this research is really a comprehensive study of, probably the most comprehensive study on this many antidepressant drugs from randomized controlled trials across the globe. And so it gives options to providers looking to treat this condition because there are 21 different options that worked in patients based on these data. So in terms of the PICO elements, can they clearly be identified? Yes. In the study, population adults with MDD, the intervention is 21 antidepressants. The control or the comparison is the control, placebo, and the other antidepressant drugs, and they measured for efficacy and acceptability. Acceptability being, did it cause major side effects? So what is the study design? I gave it 10 out of 10 points. What is the study design? Well, it says it in the title, a systematic review with meta-analysis. So these are some of the things that you guys, bless you, these are some of the things that you guys can discuss when you're doing your assessment. They used all of these different databases to find both published and unpublished data of these 21 antidepressant drugs. Now, typically, unpublished data is not always used, but the fact that they used it in this study, it just adds validity to the study, because sometimes when data is not published, it's viewed to be not as good or effective, but they included everything they could find, like everything they could find in terms of population, and they had a long, comprehensive selection criteria. You don't have to add figures into your assessment, but I just want to show this as an example of what they did. So I can't read these numbers because I'm old, and can't see, but they filtered from, 4,000 different published papers, all the way down to 522 double-blinded RCT studies. And so I just put this in here because I thought this was interesting. When you guys are doing your literature reviews, sometimes once you do your search, sometimes when you look at the title, you're gonna be like, I don't know, why did they put this in here? This is not what I'm looking for. So you'll be able to remove it without even looking at doing any more, like reading the abstract. And so even they do this for papers like this. So they filtered out how many different studies by just looking at the title of the article. And so that might be helpful for you guys when you're doing your lit reviews. So in terms of sample size, was the number adequate? Does it represent a typical population? Yes, so they had over 116,000 participants from all over the world, essentially, that were encompassed in 522 different double-blinded randomized control trials. So these studies had high internal validity and high external validity because the studies are coming from all over the globe with diverse populations of people. Were any biases mentioned? They talk about ways to reduce them. Yes, they used two different approaches. The Cochrane approach and the grade scale are methodologies used to basically assess the stringency of data. And so they also included unpublished research, as I mentioned, which is not always common. And so because sometimes unpublished research, the data is not producing an effective result, but they included that in here and they did see an effect with this. So it just adds validity to this study. Statistics. They used a number of statistics, and there's a hidden slide with like simplified definitions of the different statistical applications they used. Confidence intervals, p-values, effect size, things that we talked about in the biostats lecture, and then some other things that I had never even heard of because I had not looked at studies of this magnitude. The SUCRA study, and then head-to-head comparison where you're comparing drugs between each other without looking at a control. So they did a number of statistical applications to determine a true effect size in this study. What's the clinical significance? Well, there's a lot in this study. I mean, as I mentioned, this is study has high internal, high external validity. It includes a large sample population. And so this study is foundational for treating adult patients with MDD. And so basically, as providers, these providers, you can basically, if you don't have one of these, if one of these 21 drugs aren't working, you can keep moving down the list, all the way until you find a drug that works out of 21 options. I don't know a lot of conditions that have this many options for treatment. And of course, the treatment would be based on the side effects and symptoms, side effects of these drugs, and if these drugs interact with anything else the patient might be taking. So of course you would have to do patient counseling to figure that out. But I feel like these data are highly clinically significant. I just added what I might do, how I might change the study. I might recommend a similar study in children with major depressive disorder. So fluoxetine is the mainstay drug that's found to be highly effective in children, but of course, not everybody responds the same way. So if children are not responding to fluoxetine, maybe doing a study with some of these drugs in children might help. Also increasing the duration of the study. They only looked at 8 weeks, but they only looked at they only looked at 8 weeks, but sometimes these drugs take about 2 months or even longer to produce the true effects. Even though they did see significant effects, they might get different results for a more long-term study. And these are just suggestions. I mean, if you don't have any suggestions for the study, you don't have to put anything. But you could have a greater effect size for a longer duration is something that I thought may be an option. Then the writing structure. And so I gave this a 5 out of 5. So this was not that easy to read, but it was a very thorough paper. It required me to do more research, of course, particularly for the statistics, because I hadn't used all those applications. So you guys might have to do this when you are looking up your papers for your PICO project. So in this slide deck, I've included all of the other information from previous slide decks to help you do your assessments in the subsequent slides. I gave this a 49 out of 50 for this paper. So make sure you guys don't forget to do the numerical assessment and the actual text assessment, commenting on the questions asked in the rubric. Are there any questions about the assignments? Yes. So there's a template Word doc attached. You can just type your responses in, and then you'll just attach it. Yeah. Any other questions? Again, if you guys have any questions, you can canvass me or stop by my office and I'll answer them. I'm sure you guys will do fine. I'm not worried about y'all. Just follow the instructions, because when the instructions aren't followed and I'm sitting here reading these things at 1 a.m. and I'm old and my eyes are messed up, it's gonna make me an even more grumpy old man than I already am. No laughs, okay. Huh? I'll be up. I'm up. Old people don't need that much sleep. Huh? That's really why I'm up, for real. I'm old and I use the bathroom a lot because my BPA is high. So I'm TMI, but that's why I'm up. So any other questions? All right, again, you guys know how to reach me if you have any questions, and I'll